We are back at HIMSS 2018, where the world connects for health in Las Vegas. I'm talking to folks here about data, health data, population health, and how we can make the world a better place. And I'm speaking with Eric Sullivan, Senior VP of Innovation and Data Strategies at Inovalon. Hi, Eric, and welcome to Harlow and Healthcare.
Hey, David. How are you doing? Thank you. Thanks for having me today.
A pleasure. So, you folks have a tremendous data store at your fingertips, and I'm interested to understand what kind of data that is, where it's coming from, what you're using it for, what you see the opportunities as being for you and your clients in leveraging this data and the intelligence that you put around it.
Sure. Yeah, we have, Inovalon has been around for about 20 years now, just about, and had primarily started focusing around supporting the collection of data and analyzing of data for health plans, right? Improving quality, confirming presence of certain diseases, so we had started with just collecting as many had industry health plan data, which would be your inpatient, outpatient claims data, your PBM or prescription data, lab results when you can find it, to say that someone's hemoglobin A1C was a value of X from partners such as Quest, and that was kind of the starting of our data set. And you flash forward to today, we have been amassing and de-identifying and amassing this large longitudinally connected data set. It's got roughly 230 million patients in it, but it's health plan data, but it's now has all the different flavors of data in terms of patient reported information, clinical data from electronic health records, kind of analytic outcomes data, socioeconomic information. So all that data has been amassed together, and I think what we're, going back to your point about what do you do with all that, the goal is always to have the most complete patient profile. So if I'm looking at you and I want to ensure I understand your quality of care or your prognosis with your diabetes or what have you, doing so with incomplete data is obviously you're going to get to the wrong answer and that can have devastating impacts. So our focus has always been collecting as much complete and timely data to build a patient profile. Wrap it, kind of that 360 profile of a patient, because then the analysis of that patient then becomes complete and more valuable to our health plan clients, to our pharma clients, to our health system partners. And we have a lot of, we're no longer just a health plan analytic company. We support health systems, ACOs, pharmacy, and life science companies. So, they're all interested in that same complete patient profile.
So is this a data-only service, data and analytics service, or is there a consultative component to the work that you do as well?
It's interesting. We had always been providing, it's kind of, if you think about at least our business model in this space, and I'm sure there's plenty of folks here at HIMSS that have a similar model where we focus on kind of connectivity, bringing data in from EHRs and having interfaces with different entities, and then managing and linking and making sense of that data, that disparate data, then analyzing and intervening, and ultimately measuring results, right? But consulting was always kind of just our fiber of how we did business. We never had a consulting company. Inovalon we never charged for a consulting hour. We just did it as part of our standing up a relationship.
Sure.
We come in and help. But when we acquired Avalier about 2.5 years ago, we really started, appreciating the value of that really deep relationship that you get from purely consultative engagements. And I just had lunch with a very large U.S. health plan, and they were so impressed by the consulting advice that they would get from Avalier to help them with, whether it's looking at their network design or how they engage their patients. So up
Dan
until
and his team have done some incredible things.
Dan Mendelson's team is incredible.
Different strengths.
Yeah. So now when we look at our engagement, we kind of we bring Avalere with us in all our meetings with a health system or health plan, because there's ultimately always some type of consultative angle that's important, right? So they may be working with Inovalon to collect and analyze and leverage, AI and do all these really great things with the data, but there may be some deep policy and construct issues they want someone like Dan Mendelson's team at Avalere to help with. So that's like our fifth pillar, effectively, as a company.
Right. So is there a certain perspective that you would say you bring to the table? Is it a question of opening the eyes of the client to some hidden connections between various types of data? I'm sure it varies from engagement to engagement, from client to client,
right,
to sort of project to project. But is there a way that you could describe an approach here that sort of sets you apart? Because frankly, there's certainly plenty of folks who are aggregating data, applying analytics to data.
Sure.
What's the special sauce?
Right. It's true. There's obviously here at HIMSS, I probably passed 100 different companies that study data analytics and data management. And I've been in the data side of healthcare for probably almost 25 plus years. When I think about what we're doing here, is what the differentiation, I think, from our perspective and what we bring to our clients, which are some of the largest systems and carriers in the U.S., is the data asset, right? So we have, as we kept growing over the last 18, 20 years, we've amassed this data set that's longitudinally linked, de-identified at the patient level, and it's got almost a 250 million lives in it, right? It's 230 million lives, and that's really key, right? So if you're trying to train analytic models, if you're trying to create benchmarks for what one should expect in a given geography for a given disease, a given utilization, without having that depth and breadth of data, I think you're operating somewhat blind. You're using your own clients' data to set their own benchmarks, and So I think the first response to that, David, would be the data assets that are kind of it's a depth of insight of what's already happened in U.S. healthcare really is powerful for us training our traditional predictive analytic engines, our machine learning and NLP engines as well. The other part of that I would just say is we can come back to AI, which is another big term here at HIMSS. The connectivity of our platform has been an important part of our partnerships, where we are working with plans and systems, and the fact that we're connected with 130,000 different providers through different interfaces with EHR companies is an important part of the story, because right now the data, without that, you would have a health plan trying to make connections with, those same EHR partners, and it's not a skill set of a payer. It's not going to be in the IT queue for a hospital, because they're probably too focused on implementing their Epic install or something. So I think us bringing to the table not just that depth of data and insight, but also the connectivity is really powerful.
Great, it is powerful. Data, connectivity, and insight.
Right.
Well, I've been speaking today with Inovalon. Thank you very much for connecting at HIMSS.